Hello everybody, this is Dr. Arun Panda, facial-maxillary surgeon from Mumbai once again. So on my birthday, I was thinking, why not I gift myself something very exclusive which is going to make me happy. And then I decided to get myself injected with botulinum toxin type A for my forehead lines. So this is where I am going to inject myself with Siax, the botulinum toxin type A. I love this product so much. I have been using it on myself, my family and all my patients since some time now, and I am going to show you how to inject and how I am injecting myself for the forehead lines. So what do we require for injecting ourselves with botulinum toxin type A for the forehead lines, frown lines, crow's feet, etc.? All we require is the products. So what we are going to use here is Siax, botulinum toxin type A. And what I have done is I have already reconstituted the toxin with normal distilled water, and I have also loaded this in 3 different syringes with 10 units each. So the reason why I have filled up in 3 different syringes is because after 4 or 5 pricks, what happens, the needle tips becomes blunt. So I would rather use a few syringes, which is going to make the whole experience painless. So here first we will do the marking for the forehead lines, and then we will be injecting again. I have cleansed my forehead with forbidden iodine solution, and I have already applied a little bit of a Prilox on my forehead. Now let's do the marking. So the first thing, as we all know, the first thing is we have to ask the patient to raise the brow so that we get the highest point of the brow. So we do the marking there. That's the highest point of the brow which is raised. So we draw a vertical line here. That's my lateral margin. The same thing on this right side. Okay, so that's going to be the lateral most points. Now just beyond this is the temporal fusion zone. So we are not supposed to go beyond this, right? Now the second marking is 1 centimeter above the eyebrow, because as we all know, the botulinum toxin diffuses by a centimeter. So the second marking is about a centimeter above the eyebrow. Okay. Okay, so this is my goalpost zone or no-fly zone. So we are not supposed to inject in these areas. Otherwise, there are chances of eyelid ptosis, because the toxin might diffuse down and might cause the paralysis or the relaxation of the muscle of the upper eyelid. Now the second thing is, now the markings should be about a centimeter from here. I think that should be sufficient. So my first marking is going to be here, 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 here. So I have applied a little bit of ice in these areas to reduce pain. Lost a little bit for marking because of the ice. That's okay. So once we have done that, so I'm going to take this syringe, and then what I'm going to do is, I can see the units being injected in the mirror. So the first injection would be I go here, and there. This makes a bleb of about 2 units, which is like 2 markings here. And my There goes another 2 units, that makes a small bleb again, and that's how we keep on doing it, about a centimeter distance. That's my fourth. Two units. And two units again. And my 2 units again. And now I felt a little pain. I think I'm going to change the needle here. Apply a little ice here again. Pinch the muscle. Another 2 units goes here, and then I start going up. Two unit goes here. Two unit goes here. I'm left with another 2 units. So I'll be changing the syringe. Another 5-6 units I am left out with. Two units there. The last 2 units I could inject here. Require anything beyond this to my hairline because my forehead lines are extending till here. So that's diffusion of 1 centimeter would be taking care of all this forehead lines here. So I'm going to see the results in another 3 to 4 days, which is going to last me for 5 to 6 months. Thank you for watching me.